Hi there, I'm Dr. Kristina Tansavatdi and I'm a double board certified facial plastic surgeon. Today I'm going to answer the question, what is a deep plane facelift? But before I can even answer that question, I have to first explain what does a facelift accomplish. A facelift takes care of tissue that's starting to fall in our face. Everybody knows that our jawline should look nice and smooth as we're younger, but as we age, it starts to sag right along the jawline, what we call jowls, which is causing our face to look rounded and heavier in the lower face. So what happens there is that the fat is starting to fall in the lower face. And what we're doing with a facelift is lifting all that soft tissue and fat back up to where it used to be. So now that you understand what a facelift is supposed to accomplish, let me demonstrate now with you the anatomy so you can understand what the difference is between a deep plane facelift, a SMAS facelift, or anything else that you hear out there. First, we have to talk about anatomy. So when we age, there is an area that does not move. This is called the fixed SMAS. This area here, if I move it, does not move. It's not mobile. This area is what moves and sags with time. So in order to address this, the best way is to get all the way down here and lift all of that tissue. If we do a SMAS lift, and I'm going to show you on this demonstration on this image here, you can see where the SMAS is. The SMAS is what's descending, and you can see it's also consists with the platysma muscle in the neck. It's one whole layer. And what we're trying to do is lift the SMAS muscle. But when you hear what's a SMAS facelift, the goal with a SMAS facelift is the incision is placed further back where I told you, which is called the fixed layer of the SMAS that does not move. But when you go further in, there are ligaments. These ligaments need to be released in order for you to lift the tissues. And so if you look at this diagram, this next diagram, I show you the different layers of the face. There's the skin, there's the fat under the skin, there's a layer called the musculoaponeurotic, also known as the SMAS. And then deep to that, there's ligaments that hold that muscle down. And then there's the periosteum, or deeper layers, where the nerves are located. So what we need to do is remove or release those ligaments in order to get the best lift. That is where a deep plane facelift comes into play. Because what we're doing is going to that deeper plane, going under the muscle, going further deep into the face to release all those ligaments so that the movement of the face can be in its natural state. We're moving the soft tissues back to where they have been before. So they've sagged, and now we have to release the ligaments in order to reposition them into a higher space. So if you look at this image here, I'm going to show with you the ligaments and where they're at. They're all located deeper in the face, and you can see that these have to be released. Okay, those ligaments have to be released in order for me to lift the tissues up. Without releasing that, with the SMAS lift that's further placed back here, we can't lift, we can't release those ligaments. So only a deep plane facelift can do that. Then if you look at the next image, this is demonstrating where the location of the incisions for a SMAS lift are. Here is a high SMAS entry point. Here is a low SMAS entry point. Both of those are in this whole fixed area of the SMAS that cannot be lifted. It's very dense there. What we want to do is go into the tissue that's here, that's soft. And we're going to enter the plane, get all the way to the very edge, and lift back up. We're lifting back up. So that is what we call a deep plane facelift. And that is what I propose for most of my patients, because as we age, we want to release those ligaments. If we don't do so, you're going to have sweeps, you're going to have unnatural look in the face after a facelift. And that's a telltale sign that you've had a facelift. Thank you for tuning in. I hope I've answered that question thoroughly for you. For more information, please tune in to my facelift channel at Facelift Expert. Thank you.